Now, still moving along, the number of COVID-19 patients at Mbarara Regional Referral Hospital has grown by leaps and bounds. There is now fear that pressure on the system could collapse the system. The situation isn't any different in Masaka, where there is inadequate supply of personal protective equipment, delayed allowances, and insufficient supply of the much needed oxygen. Here is a situation analysis drawn from our visits to the system.
In just a few days, there are more than 20 patients who are admitted in need of oxygen at Mbarara Regional Referral Hospital. At least 86 people are under intensive care and one person dies of coronavirus daily. It is a crisis, but the hospital has registered some success stories in treating COVID-19 patients since the first case was reported there in May.
COVID is in the community, and especially those people with high blood pressure, with diabetes, sukari, and all other comorbidities, and old age also is a challenge. We've seen a number of deaths. We've gone up to 19.
The treatment center and the intensive care unit are congested with COVID-19 patients, even if some just can't get in for treatment because they cannot afford. Samuel Nsero, a nurse here, is among those on long shifts taking care of the very ill.
We've seen it is going to be so overwhelming, it is going to be a sad story because the hospitals are full. So with increased numbers, we shall find we shall not have any space to admit any more patients, and it will be so sad.
Service delivery has become more difficult as health workers too have tested positive for the virus and are forced to stay away.
We still have the small number of health workers whereby so many patients, if there are very many, they are going to be compromised in our quality of services.
In April, the hospital received some funding meant to boost their capacity, but the construction of an isolation center has stalled. The Mbarara district head of COVID-19 task force worries they could be heading for the worst as coronavirus-related deaths increase. They are now lobbying for cancellation of Christmas holiday travels.
Of course, we shall continue implementing the guidelines. By the way, our survival will be on an individual input.
Rose Sansa recently became a widow, having lost her husband, John Sansa Mutageja, to COVID-19 in Chotera. She is still haunted by the scene of her partner not being able to breathe.
Reducing the spread of the disease, it is better to reduce other than to treat, because the effects of treatment and the repercussions of the disease are too heavy to stomach.
At the Masaka Regional Referral Hospital, 421 coronavirus patients have been sick since the outbreak, 180 discharged and 21 deaths recorded. They are now encouraging receiving treatment and managing the virus at home.
We've had a fair supply of some personal protective equipment, but we continue praying that we don't run out of these, because as we speak, over 1,000 health workers have gotten infected, including some at our hospital.
And I call upon our people, wherever you are, not to mix up messages and to inform our people, even when they have now COVID fatigue, to take care of themselves until we survive this pandemic.
Poor health infrastructure, laxity in following the standard operating procedures, political campaigns and end-of-year festivities are already propelling the spread of the coronavirus. Uganda has so far registered over 27,000 cumulative cases and over 225 deaths.
With 1,584 COVID-19 cases and 33 deaths registered in Gulu City alone, the northern region is destined for tough times in trying to curb the rising infections. On the streets, workplaces and homes, people seem not bothered about the pandemic, with very few entities observing standard operating procedures issued by the Ministry of Health.
People are reckless, especially even the taxis. You find people are packed. People are not even putting on face masks.
The government has relaxed too much on easing the lockdowns and giving the political space, trying to tighten others and leaving others work free.
We are mixing, ensuring that COVID cases go down and people are observing the standard procedures with politics.
The new home treatment policy is even proving to be more chaotic, with hospitals having less control over patients. Speaking to Dr. James Elima, the director of Gulu Regional Referral Hospital, he noted admitted cases are down, but there are notable concern that the community surge is on a sharp rise.
The community cases are increasing, and our surveillance team are tracking them. So far, we have traced and tracked up to about 300 people now in this region alone.
Everybody is tired, Ugandans are tired, and there is complacency.
The question of testing and enforcement of standard operating procedures is yet another blow to the fight against COVID-19. Dr. Lima said urban areas remain the biggest threat, with government doing little to enforce guidelines.
Actually, the next epicenter of these diseases is urban crowded areas. Urban crowded areas or urban crowding areas like the markets, the supermarkets, and so on.
Elegu border point has been the country's hotspot in regards to COVID-19. Amuru resident district commissioner Osborne Ucheng said the border situation has worsened, with travelers not even bothered about COVID-19.
The home-based care thing cannot work in Elegu because you don't have people who resides in Elegu 24/7. You have people who comes daily, transit and leave. So at the end of the day, you cannot track someone. So it is tricky.
People are having mistrust in the health institutions, and yet those who have the money, the political class, have the opportunity to access the services.
But for the region that lacks the basics in fighting COVID-19, like ambulances, government is on the spot for the surging numbers.
And you know more, since we don't have ambulance. So there are certain things via surveillance we don't have. Even enforcing certain things like guidelines of this electoral commission, we cannot, because even those ones who are supposed to enforce some gears like the police, they don't have vehicles, so they are just there.
Even on just providing masks, which go for 2,000 shillings, up to now, lots of people around the country have not even received something as basic as a mask.
With the numbers surging and political events and politicians putting lives at risk, it is not clear how the government will strategize to contain the situation, especially in the communities. Benson Ngam, reporting from Gulu.